Hi, this is Naturopathic Dr. Chris Abid. I'm sitting here with Naturopathic Dr. Christine Matheson. Christine, thanks for chatting with me.
My pleasure.
So we just have one question for you today. We're wondering, you're one of the practitioners that sees the highest number of pediatric visits at the clinic. So as a naturopathic doctor, obviously you have a very varied patient base, but what is your experience with children and with treating children?
Well, I think that it's one of my great joys in practicing is working with children, and I think that it's an opportunity to start your children's life off with some really healthy foundations. Naturopathic medicine at its very foundation is about prevention, and so working with children is the perfect example of that. So you're able to raise your children with the knowledge of what you can emphasize nutritionally for them and lifestyle-wise for them. And what's unique about how the appointment experience is that it's slightly shorter. Kids' attention span and babies' attention span is shorter, so we need to accommodate that. We actually really encourage, and I encourage with my appointments, often I might be treating mom and baby or mom and child at the same appointment to make it convenient healthcare for the whole family. And when it comes to the child, if they're of an appropriate age, I may ask them a few specific questions to help them also become more in tune with their body and to share comfortably in a trusting environment about their health or any of their concerns. But often it's mom or dad who's filling me in on the details. And I take a very pure approach with children. I think that children's bodies are extremely resilient. So we generally approach in terms of therapies, mostly looking at nutrition. And often just a couple of nutritional supplements could be indicated. You know, vitamin D and probiotics are probably the most important thing, and eventually essential fatty acids for children. And then I enjoy talking about hands-on techniques that mom can do, teaching them how to massage their children's abdomen, some basic lifestyle strategies at home that can really make a big difference for the whole family's health. And appointments, as I said, are shorter, and therefore check-ins are a little bit shorter in terms of duration of appointment. And what I really try to offer for pediatric patients and families is phone consultations. So being able to make healthcare, again, very convenient and accessible, so that if mom has already seen me, we've had our in-office appointments, and they're just wanting to check in about a quick question about what the child's eating or how they're improving, then we can talk over the phone, which is really useful. But I think what's exciting is to watch the children over time who have become naturopathic patients, who are feeling very in tune with themselves and body-wise, and start to be able to come in and say, you know, this is feeling better, this is feeling like this and like that, and without making them overthink their health, they're just becoming very self-aware and mindful little patients, which is wonderful.
Wow. Thank you so much, Dr. Matheson.
You're welcome.